We've called the meeting today to mobilise the working class against these planned cuts, which are being prepared by the Albanese Labor government. This is an assault on the disabled that will strip away essential care, force families to breaking point, and cost lives. This has to be seen as part of an international fight, which is being taken up by our movement against attacks on social programs by every government. What is happening with the NDIS in Australia is not isolated to this country. In every advanced capitalist country, social programs are being torn apart, above all, to pay for a massive expansion of militarism. The sharpest expression of these attacks is the United States, which is undergoing the broadest breakdown of public health in modern history, resulting from the Trump administration's gutting of science and public health measures. The parasite cyclosporiasis has sickened tens of thousands in the largest foodborne outbreak ever recorded. In an advanced capitalist country, the heart of world capitalism, people are becoming sick from diseases born from human feces in salad bags. Meanwhile, measles has returned at levels unseen since 1991, and salmonella outbreaks are moving through the food supply. Epitomising this attack on science and public health, this week President Donald Trump signed an executive order cutting the diseases against which all children are recommended to be vaccinated based on the long debunked lie that vaccines cause autism. Again, this is in the advanced capitalist countries. In parts of the world historically oppressed by colonial and imperialist powers, avertible epidemics are becoming health disasters. In eastern Congo, Ebola is ripping through the population. The death toll has surpassed 2,000 and is on track to become the worst in the history of the disease. How is it that preventable and treatable diseases are now on the rise and taking lives globally? The process began with the COVID-19 pandemic. Scientists warned that this was a novel virus which needed to be eradicated through public health measures like regular testing and social distancing. Countries such as China and New Zealand showed it could be done. But the profit interests of the capitalist oligarchy could not have such measures impede on their ability to extract profits from the working class. The call was not eradication, but let it rip. And, as then UK Prime Minister Boris Johnson said, quote, "Let the bodies pile high," end quote. Already struggling hospitals and healthcare programs have only been gutted further since. Why the destruction of these programs? Because society is organised for profit rather than human need under capitalism. The ruling capitalist classes, led by the US oligarchy, demands cuts against the working class at home so it can pour billions into the machinery of war and death, driving a global plunge into the abyss as they pursue resources and domination abroad. The opening shots of World War III have already been fired. The year began with the Trump administration's illegal invasion of Venezuela and seizure of its leader, putting in place a puppet regime to do the bidding of US finance as it prepares to assert control over Latin America. In February, it launched the criminal war against Iran, which has led to inflation, global devastation, and expanded the methods used in the genocidal assault on Gaza. In the Asia-Pacific, Washington is preparing for confrontation with nuclear-armed China, a conflict for which Australian imperialism, under this Labor government, is preparing to play the role of chief attack dog. These wars, however, are deeply unpopular. Across the world, millions have protested against the genocide in Gaza. In Australia, the Albanese government has responded to anti-war sentiment, not with debate, but with repression. Draconian laws equating opposition to genocide with anti-Semitism, mass arrests of protesters, and the announcement just this past week or so that ASIO and the police are preparing Australia's first ever left-wing terrorism charges. The global spearhead of this assault on anti-war sentiment is in Ukraine, and it is aimed directly at our comrade Bogdan Sirotchuk. On Sunday last week, a district court in southern Ukraine sentenced Bogdan, a 27-year-old socialist and leader of the Trotskyist Young Guard of Bolshevik-Leninists, to 15 years in prison for supposed high treason under martial law. His crime? Writing articles. 6 articles published on the World Socialist website in which he told the truth. He exposed the Zelensky regime for what it is, a dictatorship that has banned opposition parties, cancelled elections, outlawed strikes, and officially rehabilitated Nazi collaborators like Stepan Bandera, whose OUN movement participated in the Holocaust. He exposed the US-NATO war in Ukraine as an imperialist war for resources and domination, not a war for democracy. He condemned the Russian invasion explicitly and repeatedly, but insisted that the answer lies in the unity of the Russian and Ukrainian working class against both their own ruling classes. For this, the court declared his writings, quote, socially dangerous. The state ordered a destruction of his socialist books and leaflets, The Methods of Fascism. A 15-year sentence in Ukraine's prison system, where detainees are confined to cells for 23 hours a day, where overcrowding and disease are rampant, where Bogdan has already been denied urgently needed medical treatment for over a year. This is effectively a death sentence. The sentencing of Bogdan Sirotchuk is the desperate act of a dictatorship trying to terrorize this opposition into silence, to make an example of a young socialist who told the truth, and to warn every worker and student in Ukraine that awaits those who dare to speak out. 69% of the Ukrainian population now supports a negotiated end to the conflict, a complete reversal since 2022. And the same fear that exists in the Zelensky regime governs the imperialist centers. Not one major Western news outlet has reported on the verdict. The same forces that are slashing the NDIS to fund militarism are the forces that want to criminalize opposition to those wars. The assault on people living with disabilities, the persecution of opponents of war, the destruction of public health, these are elements of a single global offensive by the ruling class against the working class. And that means they are part of the same fight. The defense of the NDIS, the struggle against austerity, the fight to free Bogdan Sirotchuk, and the building of an international anti-war movement, these are elements of a single political struggle against the capitalist system and its drive to war and dictatorship. That is the revolutionary perspective we are here to discuss today. We will hear 3 reports. Our first speaker will place the cuts to the NDIS in the broader assault on public healthcare in Australia. The second will explain the impact of the NDIS cuts on already struggling education system. And our final speaker will explain the content and political background of the NDIS cuts and how they are to be fought. So without further ado, I'll hand over to our first speaker, Julia Thomas, who is the national convener of the Health Workers Rank and File Committee, the network established by the SEP to unite health workers' struggles independently of the thoroughly corporatized trade unions. Julia is also a member of the SEP's National Committee. Join me in welcoming Julia.
Thanks, Evram. And I'd also like to welcome everyone to this meeting today. The Health Workers Rank and File Committee denounces the Albanese Labor government's cuts and proposed restrictions to the NDIS, and we are fighting to mobilise health workers against this. Our committee was formed independently of the health union bureaucracies, which have either openly or tacitly supported this attack and have made clear that they will not organise any fight back. This was expressed most sharply by the Health Services Union's declaration that the cuts are a reform and a, quote, step in the right direction to drive out rogue providers. In reality, these measures have nothing to do with attacking the privatised model of the NDIS, they are directly targeting NDIS participants. This will cause widespread devastation and cost lives. Under the proposed changes, more than 200,000 people would be removed from the scheme, while thousands more will face reduced supports. Families will be forced to leave employment, providing unpaid care that should be performed by trained workers, or else pay thousands of dollars for essential support and therapy. Thousands of disability support workers face job cuts or the prospect of reduced hours and worsening conditions. Research by the Australian Institute in one report found that these cuts would result in the loss of over 51,000 full-time equivalent jobs that provide the daily care, mobility, therapy and social activities on which NDIS participants depend. This is part of a broader assault on social spending and public health care to pay for militarism and war. In addition to the NDIS cuts, the federal government's May 2026 budget ends higher private health insurance rebates for seniors, a measure predicted to push thousands of elderly people into the public system, and the Australian Medical Association noted that the budget's hospital funding was almost $10 billion short of what was required to address the cycle of crisis our public hospitals are in. The assault on the NDIS also flows directly from a broader slashing of social spending and basic public health measures. This includes the slashing of COVID-19 public health measures by the Albanese Labor government, which included quarantine, testing and contact tracing infrastructure, and the end of pandemic-related paid leave. Public health measures were abandoned and funding cut with the full knowledge that such policies would be at the expense of the lives, health and well-being of the population. Those forced off the NDIS or whose supports are reduced will have no choice but to rely on public hospitals and emergency departments when their conditions deteriorate. And what are the conditions they will confront there? Public hospitals are underfunded, understaffed and already stretched to breaking point. The Bureau of Health Investigation's latest quarterly report for New South Wales, the most populous state, documents that for patients with potentially life-threatening conditions, just 57% of cases were seen within the recommended 10 minutes. 1 in 10 patients spent longer than 13.5 hours in the emergency department, and 1 in 10 patients who needed hospital admittance waited more than 24 hours for a bed. These conditions are mirrored across the country. Quarterly statistics for Victoria's public hospitals showed some 3,300 patients across the state who were admitted to ED from January to March this year stayed there for at least 24 hours. A doctor from Ballarat Base Hospital recently told ABC News, following the death of a patient who was left waiting in ED, that it, quote, wasn't uncommon for patients to wait more than 40 hours in ED for a bed on the ward, and that it was normal for ED patients to overflow into corridors or unmonitored waiting rooms. Hospitals face widespread understaffing, and health workers experience increasingly intolerable working conditions. A recent survey by the University of Sydney and New South Wales Nurses and Midwives Association found that 2/3 of the nurses surveyed regularly think about leaving the profession. The factors involved in this include endemic understaffing, chronically busy, heavy and overwhelming workloads, and an under-provision of flexible work options. Recent hearings involving doctors in the Industrial Relations Commission have heard similar conditions. For example, a senior registrar in southwest Sydney from ED reported that their colleagues were leaving due to inadequate pay and burnout, and described escalating aggression and violence, saying that security has to be called on almost every shift. In January 2025, more than 200 staff psychiatrists in New South Wales, around half of the workforce in the public health system, resigned en masse over low pay and chronic understaffing, under conditions where nearly 1/3 of staff specialist positions were already unfilled. The state Labor government responded by only deepening its attack on public mental health care, closing several wards and mental health beds, and wait times reported for some mental health patients exceeded 90 hours. Health workers across the country are in a battle not only with state and federal governments against these deteriorating conditions, but also with the trade union leaderships. Most recently, South Australian nurses rejected a wage-cutting agreement that would do nothing to improve their working conditions, despite the urging of their own union that they should vote yes. One of the nurses' central demands, that all babies in postnatal wards be counted as patients for nurse-to-patient ratios, was abandoned by the union in promoting the government offer. Broader safe staffing claims, reclassification demands, and expanded leave entitlements were also dropped. The ANMF South Australia ran what was essentially a scare campaign, telling workers that if they voted no, it would mean years of arbitration. This was after the union had already stifled workers' action by postponing or cancelling strikes and had permitted only 2 isolated 24-hour stoppages at individual hospitals, all while they were negotiating this rotten deal with the state Labor government behind workers' backs. The same threat of arbitration has been used against health workers in other states. In New South Wales, nurses and midwives, doctors and psychiatrists had their industrial action shut down and their demands for better pay and conditions diverted into years-long, drawn-out arbitration through the Pro-Business Industrial Relations Commission. During this time, workers are blocked from taking industrial action, which the union has complied with, and for those that have had a verdict, their demands have inevitably not been met. The no vote by South Australian nurses is a powerful demonstration of the desire by workers to fight back. But to take forward these struggles requires building independent rank and file committees in every hospital, democratically controlled by workers themselves, to take this struggle out of the hands of the union apparatus. As with the fight to stop cuts to the NDIS and other social programs, health workers confront the trade union leaderships, the Labor government, and the entire capitalist political establishment. No struggle to defend disability services can succeed under the leadership of these union bureaucracies, which have subordinated workers to the Labor Party, and nor can they succeed through appeals to the Labor government. The working class must, as a whole, lead this struggle to oppose the assault on public health and defend the most vulnerable sections of the population. Every person with a disability has the right to comprehensive support, not whatever a government budget or private provider determines is profitable. Eligibility and support decisions should be based on the professional judgment of qualified health and disability practitioners and with the full participation of disabled people. Genuinely accessible, high-quality disability care must be based on science and human need, not private profit. The Health Workers Rank and File Committee calls on disability support workers, health workers, NDIS participants and their families to join in building independent rank and file committees as the basis for a genuine fight back. Such a struggle must be linked to the broader international struggle of the working class against a capitalist system that places profit above human life and social need. Thank you.
Thank you, Julia, for that description of the struggles confronting healthcare workers here, and which is only going to be exacerbated by the cuts, not only to the NDIS, but across healthcare and public health. And it's worth noting as well that the situation confronting healthcare workers is not unique to Australia either. It's a global phenomenon, and you have struggles being undertaken against these attacks across continents. Romanian hospital staff on indefinite nationwide strike, health workers walking out over pay and condition in Kenya and Mozambique, workers in the Congo, as we were discussing earlier, where the Ebola outbreak is taking place, striking without hazard pay. And earlier this year, 15,000 New York City nurses struck for 41 days before being betrayed by the union. So you have similar experiences taking place on an international scale. And the Health Workers Rank and File Committee is part of the International Workers Alliance of Rank and File Committees, which seeks to bring that commonality of the international struggles to the working class and unite them in a struggle against the global capitalist system, which is the source of these issues. Next up, we have on the speakers list Sue Phillips, who is the national convener of the Committee for Public Education, which is the educators and teachers network of rank and file opposition. Sue has also been a member of the Trotskyist movement for more than 50 years and is a member of the SEP's National Committee.
On Friday, the Committee for Public Education published an article on the World Socialist website titled "Teachers are on the front line of the NDIS cuts." That article offered only a glimpse of the devastating impact that the Albanese government's historic cuts to the NDIS will have on children and young people with disabilities, their families, carers, and the broader community. My contribution this afternoon outlines the catastrophic consequences for public education, for teachers, education support staff, principals, and students. This cruel and socially destructive assault by the Labor government must be opposed not only by those immediately affected, but by the entire working class. The government is consciously concealing the reality, aided by the teacher unions that have given the green light to this reactionary agenda through their silence. As a result, much of the public school workforce have no idea of what is coming. Thousands of young people are about to be thrown off the scheme. Educators are on the front lines of these cuts because children and young people are at the very centre of this attack. They are being deliberately targeted. Labor's program is unfolding under conditions of an already profound crisis in public schools. Staff are overworked, under-resourced, with thousands exiting schools every year. The numbers of students and young people impacted are staggering. Of the 241,000 participants set to lose access to the NDIS by 2030, 64%, that is 154,240 people, will be aged 18 or under. 60% or 144,600 have autism or developmental delays listed as their primary disability. Under new legislation, children aged 8 and under with mild to moderate support needs will no longer be able to access NDIS funding at all. Instead, they will be referred to a state-based system, the so-called, quote, Thriving Kids scheme, which is completely inadequate, tokenistic, and in many respects doesn't yet even exist. Some state and territory governments have already refused to sign up. The program funnels children into what they call education settings for limited, time-restricted support delivered through hubs rather than direct individual therapeutic intervention. Thriving Kids is not scheduled to begin until October 2026, with a full rollout delayed until January 2028. This timeline is itself an admission that state education systems cannot cope. There is a gaping void between children being thrown off the NDIS and the supposed alternative supports. Earlier this year, New South Wales Labor Premier Chris Minns stated bluntly, quote, if they're not going to be provided with NDIS support, we can't provide equivalent care in the state system. This means a massive transfer of responsibility from the federally funded NDIS onto state education systems, already buckling under decades of underfunding and soaring workloads. Under Labor's assault, access to the NDIS will be determined by measuring how much a disability impacts on a child's day-to-day life. Children classified as having, quote, low to moderate and, quote, support needs, typically those with level 1 autism, will no longer be eligible for an individual NDIS plan. Even for children with level 2 autism, Entry is no longer guaranteed by a medical diagnosis alone. Families must present extensive clinical evidence of, quote, profound lifelong barriers to basic daily tasks. Now, children aged 8 and over will be subject to standardised, what they call functional capacity assessments. Those classified as having low to moderate support needs will still be denied access. National modelling indicates that roughly 35 to 40% of school-aged children on the NDIS fall into that category. Now, as the World Socialist website has explained, these needs are anything but minor. Many require ongoing speech, occupational and psychological therapy, as well as structured support to communicate, regulate emotions, and participate fully at school and at home. The importance of early intervention cannot be overstated. Disability advocate Megan Spindler-Smith of People with Disability Australia told the World Socialist website, quote, if you don't get access to support at the right age during pivotal periods of mental and physical development, it can have long-term effects, including increased psychosocial disability and mental health challenges, end quote. The government's categories of, quote, mild and moderate obscure this reality. Children assessed as having lower support needs may nevertheless require substantial assistance to communicate, regulate emotions, participate socially, and learn safely. Without early intervention, they may enter school behind their peers, experience increased anxiety, exclusion, and school refusal, and ultimately require intensive support. These difficulties manifest in classrooms as learning delays, behavioural challenges, and social isolation. Removing individualised support does not remove the need. It shifts the burden and risks, allowing difficulties to become more severe. As a result, public schools, teachers, and ES staff are expected to absorb the consequences of a policy that we've had no role in determining without specialist staff or resources required to meet them. This is not inclusion, but the systematic transfer of responsibility onto an already overstretched public education system. In late 2024 and into 2025, more than 1,000 automated letters a week were sent to families of disabled children, demanding evidence of continued eligibility within 28 days or face removal from the NDIS. In just 6 weeks to November 2024, 7,487 assessments were conducted, including 5,872 involving 7 and 8-year-olds. At least 48% of these children were removed from the scheme. Rejection letters that were sent acknowledged that many still required what they called intensive support, but shifted responsibility to other departments that lacked the funding and capacity to provide it. By September 2024, the Foundation of Children with Autism reported that annual funding for autistic children had been cut by up to 60%. Throwing families into acute crisis. Now, compounding this, the May federal budget, Albanese's budget, announced a $3 billion cut to student engagement and wellbeing and a $417 million, what they call saving, on other disability funding. Now, to understand the impact on educators, consider Victoria's public school system. As of March 2026, over 28,000 children had completed a disability inclusion profile meeting. It's called a DIP. The DIP is separate from the NDIS. It assesses adjustments required across 6 functional domains and is the gateway, supposedly, to unlocking some school-based funding. Now, it's estimated that 15,000 to 22,000 new DIPs will need to be completed in Victoria once the NDIS cuts take full effect. Now, for teachers and ES staff, the consequences will be profound. The DIP process is extraordinarily time-consuming. Each meeting requires extensive documentations, evidence gathering, observation and reporting. Teachers must contribute detailed assessments, attend case conferences, and then implement individual plans, all of which while managing classrooms of 20 to 30 students with other diverse needs. Now, Victorian teachers already routinely work 50 to 60 hours a week, with planning, assessment, and reporting pushed into evenings, weekends, and holidays. Chronic understaffing, just like the hospitals, and unsustainable workloads have driven thousands out of the profession. Research shows 1 out of every 3 educators do not expect to remain in public schools until retirement, with 80% citing unmanageable workload, 90% reporting moderate to extremely severe stress. Now, public schools already educate the overwhelmingly majority of disadvantaged students. 90% of them are from low socio-economic backgrounds. 82% are Aboriginal students. 71% from language backgrounds other than English. 67% of students with disability and over 80% from remote areas. Now, the NDIS cuts will vastly increase this already complex situations within the schools. The challenges, however, go far beyond just a bit of paperwork. Teachers now will face increased responsibility for differentiating lessons, developing personalised learning strategies for students who previously received intensive external support. They will now spend more time coordinating with speech pathologists, occupational therapists, psychologists, where such services remain available, and more time managing the distress of families thrown off the scheme. Earlier this year, the CFPE interviewed ES staff about their conditions. Rose, who's been an ES member for about 10 to 15 years, said schools are increasingly managing severe behavioural and disability-related needs without staffing, training or support. This is all before the NDIS. She said, students with very high needs are coming into mainstream settings, but we don't have the support structures or funding to properly support them. There are so many children with diagnosis and really high needs, and families just can't get the support they need. She described ES workers performing specialised tasks. She said, you've got ES staff monitoring feeding tubes, administering medication, supporting non-verbal students, managing behaviour crisis, feeding hungry kids and supporting traumatised families. Young teachers are being thrown into really difficult classrooms because of the staff shortages, relying on ES support to get through the day. Another ES worker, Pam, and Pam's job is mainly on disability inclusion. And she described how it's an exhausting bureaucratic process requiring constant coordination between teachers, specialists, families and the department. She said, I'm usually working on about 15 students at one time. Each student can end up with around 30 separate documents. She said, we have to fight tooth and nail. If we word one thing wrong in a document, it can put us down a whole funding level. We've had to learn exactly what the department want. Otherwise, students miss out. And her job, has other jobs. She manages medication, first aid systems, and school administration. She said EAS staff routinely face violence. She said we get punched, scratched, kicked, bit and spat on, you name it. People are burning out. End of quote. For the past 12 months, Victorian teachers have fought determinedly for a new wages and conditions agreement involving 2 mass strikes this year and twice voting down sellout deals pushed by the union, representing a level of opposition unprecedented in 4 decades. Never happened, voting down agreements. The AU is now, right at this moment, attempting to ram through a third revised deal that leaves the terrible conditions in place and at the same time attempting to strangle the educator rebellion by imposing a 4-year no-strike clause. Significantly, the AU has remained virtually silent on Labor's assault on the NDIS and its consequences for schools. The union claims in their latest agreement that it provides what they say is funded release time, end of quote, for disability inclusion profiles. But that agreement itself does not substantiate that claim. It merely requires schools to recognise, quote, the time required, end of quote, for DIP participation as part of long-term planning. It specifies no hours, guaranteed release, no replacement staff or dedicated funding. Now, the AU's silence on NDIS exposes its complete agreement with Labor's agenda. Its only response is to seek what it said in a comment, we need further details. And this is happening as Labor dismantles disability support and shifts the burden onto schools, while the union bureaucracy enforces it and imposes this policy, acting as an accomplice of this assault. This exposes the real significance of the rebellion of Victorian educators. School staff have demonstrated they are prepared to fight, including rejecting union sellouts. This growing revolt also is evident among health workers, as Julia's gone through, amongst doctors, and this provides the basis for a broader struggle against the NDIS cuts and the assault on public services overall. Lessons must be drawn out of this experience. Defending students with disabilities requires a rebellion, a revolt against the union bureaucracy and a political break from Labor. The fight cannot be entrusted to those seeking to contain it. It must be taken out independently by educators, health workers, disability workers, families, and the broader working class. As Ephraim has stressed and Julia, the assault on the NDIS can only be understood within the context of the ever-deepening crisis of capitalism and the Albanese government's pouring billions into the military machine. The NDIS are part of a broader offensive against all social programs, health, education, welfare, to finance militarism and protect corporate profits. Now, it's worth considering what would 60 billion that is now being spent every year on the military, what could it provide for just in public education? 166,000 additional teachers, 100,000 education support, and 40,000 psychologists and specialists. It could mean smaller classes, properly funded disability support, and a major investment into public education. Now, a genuine fight against the NDIS requires building new organisations. The Victorian Educators Rank and File Committee, which was established last month, brings together the educators, union and non-union alike, to take control of the dispute out of the hands of the AU apparatus. Its demands include maximum class sizes of 15 to 20, guaranteed school planning time, the hiring of thousands of additional teachers and ES staff, psychologists, health workers, and a fully funded, which would give fully funded support for students with disabilities. These demands cannot be realised through appeals to Labor, the Coalition, the Greens, or the union bureaucracy. The Coalition is fully complicit in this, and the Greens urge people with disabilities to lobby Coalition senators rather than mobilising independent opposition. The ACTU, including the health and education unions, have accepted the cost-cutting program, offering only administrative amendments. What is required is the independent political mobilisation of the working class against the capitalist system itself. People with disabilities, their families, health workers and educators must establish rank and file committees independent of the union bureaucracy and every capitalist party to unite our struggles into a political and industrial counteroffensive against austerity and war and for equality and a socialist society.
Thank you, Sue. And we will have links and contact info through the course of the meeting for how educators and health workers can get involved with the CFPE and Health Workers Rank and File Committee. But now we'll move on to our main speaker today, who is Max Boddy. Max is the Assistant National Secretary of the Socialist Equality Party in Australia. He has written extensively on the NDIS, the assault on social programs, and broader issues confronting the Australian working class for the World Socialist website. So please give Max a warm welcome.
Thank you, Evram. The attack on the National Disability Insurance Scheme is the sharpest expression in this country of an assault now being mounted against the working class internationally. Across every advanced capitalist country, social programs are being systematically dismantled. In the United States, Trump declares that the federal government should stop funding Medicare, Medicaid, and childcare because, quote unquote, we're fighting wars. He called social programs little scams, and that the only legitimate function of the state is military protection. In the UK, the National Health Service, once a world-leading example of a comprehensive and free public health system, is on its knees. In Germany, the new government is slashing social spending to fund rearmament. As Chancellor Friedrich Merz said, Germany can no longer afford the welfare state. Governments everywhere are diverting resources into the military. This is the context of the destruction of the NDIS that the Albanese government is carrying out. The bill contains, as other speakers have indicated, the single largest cut to a government social program in Australian history, $38 billion over 4 years. It is the centrepiece of a budget that slashes $63.8 billion from social spending. More than 240,000 existing participants will be removed from the NDIS by 2031 and another 110,000 denied access, and almost 2/3 of those targeted at children. Now, these figures are staggering, but the brutality of the attack is also written directly into the legislation itself. To carry this out, the bill introduces a functional assessment regime in which all those on the NDIS will be tested on the bare basics, getting out of bed, going to the toilet, etc. If you can perform these tasks, you could be deemed not to require assistance, regardless of your medical diagnosis. Social and community participation, the supports that allow people with a disability to leave the house, to see friends, to work, and to have a life, are to be slashed. The legislation decrees, for the first time, that all disabilities resulting from a workplace or motor vehicle accident are excluded from the NDIS. The explanatory memorandum which accompanied the bill virtually revels in the barbarity of this new provision. It gives an example of a man who entered the NDIS because of an intellectual impairment and was subsequently left paraplegic following a car accident. He would receive nothing from the NDIS for his paraplegia and instead be directed to seek compensation elsewhere. The explanatory memorandum also states explicitly that NDIS funding can be, quote, less than the actual cost of providing or acquiring the support a person needs. Therefore, establishing in legislation that someone's funding does not have to cover the actual cost of the support they require. And finally, the legislation also concentrates extraordinary dictatorial powers into the hands of the health minister, giving the minister unilateral authority to slash funding to whole categories of the NDIS support by up to 99%, and explicitly states that these decisions cannot be challenged through any tribunal. Now, even before the legislation has passed, the cuts are underway. As Comrade Sue indicated, this is particularly amongst children. There have been reports of up to 29,000 participants have either partially or totally lost access to NDIS supports, including nearly 12,000 children with developmental delays removed without any replacement system in place. Now, these cuts will cost lives and already have. The Senate inquiry into the NDIS heard evidence from the Disability Rights Legal Service citing the case of Lee. An NDIS participant who died after 24-hour care was reduced to just 8 hours. There have also been 2 murder-suicides this year linked to the horrendous pressures families face with inadequate disability supports. In January, a Perth family died after police reported they had struggled to secure sufficient disability supports. And in May, a Campbelltown father was charged with murdering his wife and 2 sons, aged 12 and 4, who had learning difficulties. Police alleged he planned the killings after reading about the Perth case. As the other speakers have gone through, it will be underfunded hospitals, deteriorating schools who will be inundated with those thrown off the scheme. Families will be forced to pay thousands out of pocket or abandon their jobs. Teachers, healthcare and support workers will be left to fill the gap. It is why our party calls on the working class as a whole to oppose the legislation and politically mobilise against the Albanese Labor government's attack on the most vulnerable, an attack that sets a new benchmark for vicious government austerity. However, to fight these cuts, we must understand the political forces driving it. To make the obvious point up front, this assault has nothing to do with getting rid of rorting or fraud. The government's own integrity inquiry into the NDIS heard testimony from the NDIA Deputy CEO that there is no statistically valid way of determining how much fraud exists in the scheme. Without a lick of evidence, families and service providers are being vilified as rorters so that hundreds of thousands can be thrown off the scheme. And whatever occasional fraud exists in the scheme, it is a product of its for-profit design. But this fraud narrative is a cover for something larger. The cuts are part of a broader restructuring of Australian society. The Australian government is forcing the working class to bear the costs of the deepening crisis of capitalism, while enormous resources are diverted into militarism, war, and the accumulation of wealth at the top end. The same budget that strips the NDIS raises annual military spending to around $60 billion. Labor has already committed to $368 billion to the AUKUS nuclear submarine program. All of this is directed against China. And just last week, the government unveiled a parliamentary inquiry into national civil preparedness and resilience. And you had Defence Minister Richard Marles explicitly stating, quote, "This is not something that we have done in Australia possibly since the Second World War." As Marles put it, every Australian is now responsible for defending the nation. This is the language of total war, the subordination of the entire economy and society to the military and the suppression of all forms of opposition. At the same time, Labor has supported, funded and armed the genocidal slaughter in Gaza. It was the first government to hail Trump's war against Iran, and Australian forces are deployed to the Middle East as part of that criminal assault. The government that insists there is no money for people with a disability has no difficulty finding money to participate in the slaughter of Palestinians and Iranian civilians. This is what we mean when we say war abroad means war at home. The machines of militarism must be paid for by the working class, and here the government is extracting the lifeblood of people with a disability, particularly children, to fund this war drive. The result is an attack, definitely on people with a disability, but also the sick, the poor, and the working class. The issue in that sense is not the absence of wealth, but the class interests that determine how society's resources are allocated. And the record of the Albanese government makes this abundantly clear. Since coming into office in May 2022, the Albanese government has presided over the greatest reversal of working class living standards since the 1950s. Inflation has surged, food prices have sharply risen, real wages have fallen to where they were 15 years ago. Housing affordability is at the worst level on record, with mortgage repayments now consuming 45% of household income on average, and renters are in a constant state of crisis. It is a different story, however, on the other end of the scale. The wealth of the affluent has soared. Australia's richest 200 individuals has climbed to a record $707 billion. $39.45 billion in the past year alone, almost exactly the sum Labor intends to strip from the NDIS. This profound social reversal has had a significant political consequences for Labor. It no longer enjoys significant positive support in the working class. At the last election, its primary vote was barely 2 percentage points above its historic low. It retained office not because of popular enthusiasm, but because the Liberal National Coalition collapsed even more dramatically. This is an expression of the broader crisis of the two-party system. But the crisis of the old parties is not producing a return to social reform. That period is well and truly over. The opposite is taking place. Faced with growing hostility from below, Labor is moving further to the right, intensifying austerity, militarism, and authoritarian methods. The crisis is driving Labor to attack more aggressively social and democratic rights. The recently concluded 50th ALP National Conference in Adelaide laid this bare. It was the most stage-managed in the party's history, with no substantive debate, and the entire event organised around protecting unity. In Victoria, meanwhile, Labor Premier Jacinta Allen was removed, despite presiding over pro-business policies, public sector cuts, wage suppression, and anti-protest laws. Her removal was not a repudiation of the right, but a product of Labor's crisis and the pressure to intensify its right-wing assault amongst growing working-class resistance. In other words, Allen did not go far enough. Under conditions of mounting working-class resistance, as Sue has outlined, above all with Victorian teachers. Now, this is not a crisis of one government, one Prime Minister, or one Premier. It is the culmination of 4 decades in which Labor has waged war on the very class it claims to represent. This process began under Hawke and Keating, who dismantled centralised wage fixing, imposed enterprise bargaining, and launched mass privatisation. Over the following decades, Labor and the Coalition presided over the erosion of public housing, healthcare, education, and other social gains won by workers in the post-war period. It's also necessary to make clear here that the NDIS itself was a product of this period. Introduced by the Labor government of Prime Minister Julia Gillard in 2013, it was a component of a broader offensive against the working class. The scheme was designed by the Productivity Commission, a pro-market body, whose design was to create a private disability market wholly funded through the public purse, with the explicit aim of saving the government money. The Productivity Commission's recommendations did not stop with the NDIS. An entire chapter of its 2011 report was devoted to the disability support pension, and it recommended the cutting the number of people on the DSP by around half, with those deemed capable of working pushed towards employment or the lower New Start allowance. The Gillard government began implementing this agenda in 2012, introducing harsher impairment tables to tighten the DSP, and the results were dramatic. the success rate to get on the DSP fell from 69% in 2010-2011 to 40.6% in 2013-14 and just 29.8% in 2017 and 18. Gillard, Australia's first female Prime Minister, is largely remembered for her 15-minute parliamentary tirade against Tony Abbott's misogyny. However, what isn't reported is that the very same day of this speech, Labor passed legislation forcing roughly 100,000 single parents, 90% of them women, off the parenting payment and onto Newstart, slashing their income by more than $100 a fortnight and saving the government a projected $728 million over 4 years. The NDIS was part of this offensive, but the private market it created could not resolve the underlying social problems. As the NDIS expanded, state and territory governments, Labor and Liberal alike, dismantled their remaining public disability services, forcing increasing numbers onto the scheme. The NDIS also exposed an enormous level of unmet need that decades of cuts had concealed. Thousands went onto the scheme to get support they never had and desperately needed. This is in part why expenditure far outstripped what the government had planned. It is also why, while we oppose the cuts to the NDIS, we do not defend the NDIS as a means for providing disability care. It is why we stand in stark contrast to all those calling for the saving of our NDIS. The NDIS was never owned or run by the working class. It has always been the funneling of public money into the market and private hands. And Labor is not abandoning the market model it created. In fact, it is using the model as a battering ram for the wholesale assault on people with a disability and their families. And under conditions of a global crisis of capitalism and the opening shots of World War III, Labor as the party of capitalist rule will be compelled to go further. While hundreds of thousands of people with a disability, the majority of children, are the first target, they are not the endpoint. All of society must be subordinated in the interests of profit and war. And there is historical precedent for what this means. When the German ruling class prepared for the last World War, it brought the Nazis to power. Their first task was to destroy the most combative working class in the world. The trade unions were smashed, the communist and social democratic parties were banned, and thousands of militants were rounded up into the first concentration camps. One of the first targets of Nazis' extermination program were those with a disability. Compulsory sterilisation of those diagnosed with certain physical and mental conditions was legislated in July 1933, within 6 months of Hitler's appointment as Chancellor, with some 400,000 individuals forcibly sterilised. By 1939, as war loomed, this escalated into systematic mass murder, beginning with disabled children. The T4 program, as it was called, ultimately claimed an estimated 275,000 lives. The underlying premise of this program was the capitalist conception of eugenics, that those who cannot produce profit through their labour or serve as cannon fodder for war are useless in the eyes of the ruling class. The sick, the infirm, the elderly are all seen as a burden on society. This is the undercurrent that guides the legislation Labor is set to pass next week, as it did with the policies of the unchecked spread of COVID-19, which again fell predominantly on the most vulnerable. But the assault today is not being carried out by the jackbooted fascists. It is being carried out by a party that presents itself as the party of the working class. I mean, Albanese is the head of the so-called left faction of the Labor Party, a designation that now loses all meaning. However, it is important to point out that Labor cannot carry out this task alone. It is supported by the entire parliamentary establishment. The Liberal National Coalition, a party in a state of free fall, openly supports the NDIS cuts and have confirmed the bill will pass next week, largely unchanged. But a critical role has been played by the Greens in ensuring there has been no direct opposition. From the moment the legislation was announced, they have postured as opponents of the cuts while working systematically to channel opposition back into a parliamentary dead end. This is not new. In 2010, Greens leader Bob Brown signed a formal agreement with Prime Minister Gillard, binding the Greens to vote for every Labor budget and oppose any no-confidence motion. The Greens were fully responsible for every austerity measure that I went through earlier, including the attack on DSP, on the disability support pension, and single mothers. That is precisely the role they are playing today. In late June, the Greens struck a deal with Labor, passing its tax measures in exchange for an extension of the Senate inquiry into the NDIS legislation. A sham from the outset that released its final report on Friday, which contained just one recommendation: the bill must be passed. At the August 2nd National Day of Action, Green Senator Jordan Steele-John urged people with a disability and their families to lobby Liberal Party MPs. That is the same coalition that had just struck a deal with Labor to ram the bill through. I mean, the Greens are a safety valve. Their function is to ensure that the anger this assault generates is vented harmlessly into parliamentary procedure and ultimately buried there. They have assured that no genuine opposition has emerged and the bill will become law. The trade union bureaucracy have played an even more reactionary role. And as Julia went through, the Health Services Union, which represents thousands of health workers, hailed the reforms, hailed the legislation as a genuine turning point. And the Australian Council of Trade Unions likewise completely accepts the cost-cutting framework. Not a single union called for the legislation to be defeated. Not one has called a strike, a walkout, or any form of industrial action against the largest cut to a social program in Australian history, a cut that will destroy up to and maybe exceeding 140,000 jobs in the sector. The union apparatus, therefore, offered its assistance to Labor in imposing the measures. And the groups, the various pseudo-left groups that call themselves socialists, Socialist Alternative, Socialist Alliance, Solidarity, they operate as a left cover for this entire process. They oppose the cuts and organise protests, but their perspective is to promote marches and petitions in collaboration with the Greens to pressure the very Labor government carrying out the attack. And they are silent on the criminal role of the trade unions. The conclusion our party draws is entirely different. People with a disability and their families cannot look to the Greens, Labor or the unions. But nor is this a fight they can win in isolation. The working class as a whole must come to their defence. This means building rank-and-file committees in every workplace, health service, school and community, independent of the trade union bureaucracy and every capitalist party. The developing class struggle we are seeing with teachers, nurses and health workers that Julia and Sue have outlined, these struggles must be consciously unified with the fight of people with a disability and their families. The Socialist Equality Party calls for the working class to politically mobilise against this legislation. The bill must be withdrawn, every participant reinstated, every cut restored. Disability care must be organised as a public service under public ownership and democratic workers' control, according to social need. The billions poured into war must be redirected into disability care, health, education and housing. But none of this can be achieved within the framework of capitalism, nor outside a struggle against war. The same profit system, stripping the NDIS to fund war, is incapable of providing decent health care to anybody, but really the rich and wealthy. So long as healthcare is a commodity and human need is subordinated to the accumulation of wealth, the most vulnerable in society will always be treated as a burden. The only solution is the abolition of the profit system and the socialist reorganisation of society. Free, high-quality healthcare for all must be a basic guaranteed social right. This requires the international unity of the working class against capitalism in every country, and the building of the party as the revolutionary leadership of that movement in Australia and as part of the International Committee of the Fourth International, the World Party of Socialist Revolution. The Socialist Equality Party is that party, and I call on everyone at this meeting today to join the SEP and take up the fight for our future. Thank you.